Hey, my name is Trey Freeman, and me and my lab partner Allie are doing a project on Alzheimer's disease due to Dr. Nicole Mashburn for Biology 201 at Calhoun Community College. Allie came up with most of the information. She covered the PowerPoint, which I will be covering in today's video. It's basically just on Alzheimer's and what it is, and just basic information and main topic points. And I also have a list of famous people who received the disease, some earlier, some later, early onset. I'll get into that here in a minute. But if you hear random noise in the background, I'm sorry. I'm recording at my gym. My grandma has been vacuuming for the past 2 hours, just a side note, so I'll let you guys know. But to get started, we're just going to talk about what is Alzheimer's. Alzheimer's is the most common form of dementia that is progressive and negatively affects memory, behavior, and cognition. It is a neurodegenerative disease, meaning it consists of progressive death of brain cells, which causes the deficits that present with the disease. So, for instance, for anybody that loves romantic movies, The Notebook is a perfect example of Alzheimer's, because the old man comes and reads a book to this lady every day, and he wrote the love story about their life. And at the end of the night, it's an everyday occurring thing, because she doesn't remember who he is at first. She just thinks he's an old guy reading a book to her. And she suddenly remembers after hearing the story that that was her husband. And it's just a really good movie if you guys haven't seen it, just a side note. But Alzheimer's is classified into two subcategories: early onset, which is the development of Alzheimer's at the age range of 30 to 60 due to the inheritance of a genetic mutation of their biological mother. It only represents less than 10% of patients with this disease. Late onset, which is the most common type, resulting in the development of Alzheimer's in the mid-60s or later. So, moving on, we have the diagnostic test of Alzheimer's. So brain imaging tests such as magnetic resonance imaging test, an MRI, or a computed tomography, CT, gives images of the brain and rule out any other conditions that present with the same symptoms as Alzheimer's. Genetic testing to test for APOE-E4, the highest risk gene associated with late onset Alzheimer's. This testing does not determine if someone will develop or currently has Alzheimer's, so the research is somewhat controversial. Mini mental state exam, a test that involves asking the patient of a series of questions with a high score of 30, 20 to 24 indicates mild dementia, 13 to 20 indicates moderate dementia, and 12 or below indicates severe dementia. So the mini-cog, which involves the patient recalling the names of 3 common objects and drawing a clock with all of the numbers in the correct spots to test cognitive health. So like I said, I have side notes of patients, or not patients, but well-known people that received Alzheimer's. So in 1983, President Ronald Reagan designated November as National Alzheimer's Disease Awareness Month. Reagan himself later died to the disease. So Ronald Reagan, one of the greatest presidents in American history to most, he was the one that actually designated November as the National Alzheimer's Awareness Month, and he later died from that disease. Moving on, we have warning signs and symptoms. And warning signs and symptoms include memory loss that affects daily life, difficulty completing day-to-day tasks, confusion regarding time and location, poor judgment, misplacing things without being able to retrace steps, new writing or speech problems that were not an issue before, challenges in problem solving, behavioral changes can include aggression, and hallucinations and paranoia. So these things are the symptoms of when you may know that somebody has Alzheimer's. And moving on from there, we have organ system primarily affected. Alzheimer's mainly affects the nervous system, which is the brain, spinal cord, and nerves. It affects the brain and nerves by forming amyloid plaque, which are pieces of dead brain cells and proteins, neurofibrillary tangles, and an accumulation of tau, a protein that tangles causing nutrient transport to be blocked, killing brain cells that all cause shrinkage of the brain. It also reduces the production of brain chemicals needed for neural communication such as acetylcholine, norepinephrine, and serotonin. And another famous person well known is Pat Summitt, which was a legendary coach at the University of Tennessee. She was an amazing coach, won 8 national championships with the University of Tennessee. She recently announced that she was diagnosed with an early case of Alzheimer's. So that's one of the early onset examples of Alzheimer's. And moving on from there, we have Just a few pictures of how the brain changes in the normal brain compared to the Alzheimer's brain, which you can see in our information sheet. Alzheimer's results in brain shrinkage and neuron damage caused by the buildup of amyloid plaque and neurofibrillary tangles. From there, we go to organ systems that are secondarily affected. The digestive system can negatively affect during the late stages of Alzheimer's disease. The deficits caused by the disease can cause difficulty in swallowing. This can cause pneumonia, therefore also affecting the respiratory system, because the difficulty swallowing can lead food or liquid to travel into the airways. It can also cause incontinence, bowel incontinence, and urinary incontinence, affecting the urinary system. And it can also affect the neuromuscular system as the brain begins to reduce the production of neurotransmitters needed to produce skeletal muscular movement. Walking can become difficult, and the parts of the brain needed for basic daily function are deteriorating. And from there, we have another famous person known as Norman Rockwell, which was one of America's most famous painters. He was well known for his illustrations on the cover of the Saturday Evening Post. Rockwell, like Reagan, also died of disease. His paintings are now used sometimes in dementia therapy because of the memory and nostalgia they elicit. So Norman Rockwell, his paintings are sometimes being used in dementia therapy because it helps with memory. And moving on from there, we have risk factors, which are uncontrollable risk factors are factors of life that cannot be controlled, such as age, sex, or genetics. Some uncontrollable risk factors related to Alzheimer's is age. Elderly individuals are at a higher risk. Genetics, genes play a role in early and late onset Alzheimer's, and sex, that women are at higher risk. Some controllable risk factors are factors of life that can be controlled, such as obesity, activity, smoking, etc. Controllable risk factors related to Alzheimer's. Some of the risk factors related to Alzheimer's can coincide with factors related to cardiovascular disease. High cholesterol, high blood pressure, diabetes, which could be considered both controllable and uncontrollable, smoking and obesity, brain activity, physical activity, depression, and cognitive inactivity. The last four could be considered uncontrollable only in very special circumstances. Moving on from there, we have treatment for Alzheimer's, but there's no specific treatment or cure for Alzheimer's as for now, but there are drugs being used to slow the symptoms of Alzheimer's. These drugs include excuse me if I don't get these words right, galantamine, rivastigmine, and donepezil. They are cholinesterase inhibitors, which prevents the breakdown of acetylcholine. Acetylcholine helps with the brain memory and cognitions. Other drugs include memantine, which regulates glutamate. Glutamate can lead to brain cell death when produced in excess. In current clinical trials, researchers are testing treatment methods such as immunization therapy, cognitive therapy, treatments in diabetes and cardiovascular disease, and increasing physical and brain activity. Prognosis. There's no cure for Alzheimer's, only treatments being tested to slow down the symptoms. It is fatal regardless. Since there are different stages of Alzheimer's ranging from mild to severe and early onset and late onset, the prognosis is different for each case. The stages move from mild, where daily actions tend to be compromised, to moderate, where memory loss is deteriorating and behavior changes are visible, then severe, where the Alzheimer's is fully progressed and memory and functions are severely compromised, walking at risk for infections, incontinence, and will most likely result in death. Pre-Alzheimer's disease can last for years before the symptoms present themselves, and usually people with Alzheimer's only live 4 to 8 years after diagnosis, but some can live up to 20 years depending on individual circumstances. So, Sugar Ray Robinson, which was recognized as one of the best boxers to ever live, he also fell sick to disease and died at the age of 67, but he died with a welterweight and middleweight title belts and finished with a record of 173 wins, 19 losses, and 2 draws. And it is not known to this date whether his head injuries contributed to this disease, but no one's for sure. And some interesting facts about Alzheimer's is the 6th leading cause of death in the U.S. 1 in 3 seniors die of Alzheimer's or dementia. Almost 2/3 of Americans with this disease are women. In her 60s, a woman's risk for Alzheimer's is 1 in 6, more likely than breast cancer, which is 1 in 11. Alzheimer's causes brain atrophy or shrinkage. The disease is named for Dr. Alois Alzheimer, who in 1906 found the brain tissue damage in the brain of a woman with a mental illness. And so for my last famous character is Robin Williams, and there's no need for an introduction for him. If not, you need to go back and watch the original Jumanji. But he also began to suffer from Lewy body dementia, which is believed to be a critical factor that led to a suicide in 2014. So this was our presentation on Alzheimer's. Thank you for listening.